The CAMP program, which stands for Carolina Assessment of Medications Program, is a team consisted of clinical pharmacist practitioners and certified pharmacy technicians. So we have many missions. Our main missions are to improve medication education, improve medication utilization, and then also accessibility to medications.
I was referred to the CAMP program from my primary physician, actually after an annual physical where he had noticed things had changed and perhaps there was something else that I needed to pursue as far as coaching to work on my blood pressure.
He came to me with really wanting to reduce his blood pressure, trying to reach goals in that aspect of his care.
Diana?
Yes, nice to meet you.
Pleasure.
How are you doing?
I'm doing well.
Nice to finally meet you in person.
Yeah.
And during our first visit, he'd mentioned to me that he'd been on his same blood pressure regimen for decades and decades. And he wanted a pharmacist to look at it and say, hey, I know it's been a long time since I've been on this. Is this really the best for me now? Or is there something out there that may be better since I'm not really reaching the goals that I'd like to? So we were able to get him enrolled, teach him how to do home blood pressure monitoring, so I was better able to assess, what his current status was.
I really liked the part about, having to check and monitor my blood pressure and logging it. There was some eye-opening data there, because my blood pressure would be different at different times of the day. And so I guess it was more of an awareness and the coaching about some of the lifestyle issues I thought were important.
After about 6-8 months, he reached his blood pressure goals. So from there, we were working on things that he could augment in his lifestyle. And when he graduated the program, he'd met all of his blood pressure goals. He felt healthier, happier, and it still remains on that regimen to this day.
Perhaps this was a junction, my doctor's recommending this. I thought I would give it a try. And was actually quite pleased with the whole process and the outcome.
The benefit of patients in the CAMP program is definitely that you have the ability to work with a highly qualified clinical pharmacist, but you also get to have continuity with them. So I think what sets us apart is that we're able to have extended visit times, so we're able to talk to patients for up to an hour at times, and then we're also able to have many follow-ups.
It was remote. I wasn't meeting with someone. I wasn't going to a facility. It was convenient. I could schedule an appointment over my lunch period. I was currently working at the time, so I could schedule 30 minutes with Diana and take the meeting in my truck. Take a chance because there can be positive outcomes, and it's not hard. It's convenient. You're working with a good team. You get support from either your primary doctor and the CAMP program. I'm just telling you that there's opportunities for improvement at the end.